Zoonosis refers to infectious diseases that can be passed from animals to humans and vice versa. Well, Dr. Veronica Bingamon is an associate at ABQ Pet Care Hospital and joins us this morning with more information about how zoonosis is transmitted. Now, I have never heard of this. First of all, welcome to you. Thank you for being here.
Thank you for having us again.
And please educate me and our viewers who don't understand more about zoonosis. It's a foreign concept to me.
Yes, absolutely. It's a different, it's a different word. I know it's not something that a lot of people have heard, but it's zoonosis and also zoonotic diseases. And just like you said, it's the transmission of infectious diseases between pets and humans, or animals and humans.
Okay, so how does it exactly involve our pets? How does it all happen?
Well, what happens is that there's different things that can cause our pets to become infected, and then if we become in direct contact with them, we can get infected also. So what happens is there's different kinds of parasites. Some of them can be on the skin, some of them can be in the intestines, and if we have any direct contact with them, we could potentially get them as well.
What are some of those common parasites so we know what to look for?
Definitely, I want to mention one virus. Rabies, of course, is the one that we all are aware of. So those are transmitted through bites. The other things are, so more of the parasites, the intestinal parasites, like Theo here, who is the pet of the week, who is a puppy. A lot of puppies, most of them have worms, and it's something that they get from their mothers, and their mothers got it from their mothers. So roundworms, hookworms, tapeworms, those are all things that they can become infected with.
Chi-Chi is getting a little bit frisky here.
Yes, she is.
Hi, Chi-Chi.
This is
I didn't mean to not introduce our little cutie. This is Chi-Chi. She likes the bling as much as I do, apparently. Look at that. Oh, there she is.
She's a Nisa, our veterinary assistant's dog.
Well, I want to get back to the serious note of this, because I want to understand how humans and our pets can become infected. Because, I'm curious, for those people out there, what symptoms they should be looking for, specifically the symptoms for themselves and for the pets.
Absolutely. The big thing is that, of course, puppies and kittens, they're more at risk because they can get it from their mother. Also, being at the dog park or areas where there's other pets, they can be exposed there. Also, even in our backyards, there's a lot of critters that walk through there, and our dogs are very close to the ground, so they can get affected. But some things to look for: is your pet more lethargic and tired? Are they more gassy than usual? That's another sign that something's going on in the intestines. Are they starting to have soft stools that aren't resolving? So some signs like that. In addition to that, are they starting to itch? Scratch. All of a sudden they're just scratching like crazy, or they're running and they stop and they bite themselves. Things like that. Anything abnormal like that, come and see your veterinarian right away, so that way we can identify it and start treating it.
Now, speaking of treating it, how does the treatment process work?
The nice thing about a lot of these diseases that could potentially become zoonotic, it's easy to treat them. The thing is that we need to do some diagnostic tests. So if they're having diarrhea, soft stools, we need to do a stool sample. So bring in a sample, we can do a test on it, see what kind of parasites they have. Now, you mentioned that there are certain things we should look for based on what happens when they're outside a lot.
So would indoor pets also be just as much at risk?
Absolutely. I hear that commonly, that, oh, my pet's an indoor pet, an indoor kitty, she won't or he won't get affected. It's fine. They don't need to be on prevention. Absolutely, because if that one case that your kitty goes outside and they come back, they could have potentially been exposed. It takes just a small amount of stool sample or anything like that to become infected. Also, again, when they're out on the walks, our dogs' noses are in everything and everything, and they want to taste it because their mouths act as their hands. And I know it's not glamorous.
But it's the reality. And as the weather's starting to change, we're expecting it to get a little colder really soon. So how does weather affect what happens as far as the rate of infection?
Each season brings on different types of parasites that are more common, but overall pets are exposed to parasites year round. That's why it's so important for them to be on prevention year round. But in the winter, we worry about the critters that come into our yards: squirrels, skunks, raccoons, things like that. They carry fleas, they carry parasites, so it can be on our lawns and everything like that. And in the summer months, of course, you're going out to the lake. Giardia is a big parasite that they can get from water. Of course, we can get that as well. Freestanding water. There's a lot of different things that our pets can be exposed to.
Well, we think about all the things that they can be exposed to and the possible symptoms, but are there any steps we can take? Because I understand that you were going to give us maybe 5 tips that we can do to prevent disease transmission between animals and humans. humans so that we can all stay healthy.
Exactly, yes. So the good thing is prevention. So number one, wash your hands. Good hand hygiene. I can't stress that enough, especially for our kids. You know, going to the petting zoo, anything like that, make sure you wash your hands. We worry about salmonella and other parasites that they can become infected with. And then the next thing is, if you're at risk, if you're immunosuppressed for any reason, or if you're pregnant, you want to wash your hands when you're, or excuse me, wear gloves when you're changing out the litter box, and change it regularly and quickly. You know, don't let it sit there for a week or so. Just change it right away.
Great tip.
Also speak to your human doctor about that. The other one is when you're out on a walk. You know, I'm sure a lot of us, when we take our pets out for a walk, there's stool all over the ground. Pick up after your pet, so that way we can, it's for the environment and also for our pets, so then that way they're not exposed to parasites.
Exactly.
The fourth thing is going to the veterinarian, doing yearly exams and getting those stool exams done. And also, if there's any concerns, like we had mentioned about diarrhea, itching, come in right away.
You really can address everything. And there was one more.
Yes, and the fifth and most important is prevention. An ounce of prevention is worth a pound of cure. You know, so you you gotta come in, get them on prevention, heartworm prevention, flea and tick prevention, intestinal parasite deworming. Everything like that. It's so important, because that way we're ahead of the game, and so that way they don't even get sick at all. They're just already being prevented.
And we want to get them over there to see you. So how can our viewers reach you over at ABQ Pet Care Hospital?
Yes, definitely give us a call at 299-VETS. That's 299-8387. You can also like us on our Facebook page. We're going to start having a Perfect Smile contest starting November 16th. So we'd love to see everybody's perfect smile and get you possibly to win it on our calendar. But please come visit us.
Thank you so much, Veronica. And we'll see more of our Pet of the Week a little later on. Thank you, Chi-Chi. And coming up next on New Mexico Style, how to make your own wine. Ooh, I like that.
I like it.
You were fun.